Hi, everybody. Welcome to the Kidney Coach YouTube channel. I'm naturopathic Dr. Fiona Shen, co-founder of the Kidney Disease Solution, and co-author, I should say, and co-founder of Kygenesis, which is our supplements that support the program. And I am joined again today by the amazing Jessianna Saville. She is the, would you say owner? What are you? The director of Kidney Nutritional Institute?
All the hats.
All the hats.
Founder. Director.
She does it all, which means she doesn't get a summer. We were just talking about that before we hit record. But Jessianna is a renal dietitian. She is an expert in treating all things kidney related via the diet. She's also really great with things like polycystic kidney disease, and she's really, her and her team are really pioneering the way along with us about really changing the dialogue around kidney disease and the fact that kidneys can heal and that it might be a bit more treatable than everyone has led you to believe. So I'll put Jessianna's details in below, but Kidney Nutritional Institute is the name of her team and organisation. Jessianna, thanks again for joining me. Always appreciate you being on here.
I love coming on here because I share that same passion, that nutrition, lifestyle. There are, tools out there for people so you don't have to be on that slippery slope to dialysis. And that's what we're all about.
Yeah, it's, I'm pulling in some big references for this new program I'm building out. And I was talking to Lindsay, who's part of your team. And there, when you get on Google now and you look for things like lifestyle and all of that stuff that can improve kidney disease, there is so many research studies and literature now. It's not just us saying it. There is just so much out there that can say that kidney disease can be improved. So, yeah. So today we're going to talk about foamy urine, bubbles in the urine, what that means, how do we treat it, what can we do naturally about it, what does that mean in terms of kidney disease and our function, all things bubble, foamy urine. So I'm going to hand it across to you to first, maybe let's cover what it is, what it means, why does it happen, why does our urine get bubbly, does it definitively mean we have kidney disease?
Okay, good question. Now, there's a common question that comes up, and it's really important to know symptoms of kidney disease because outside of labs, symptoms can be a good marker of what's working and not working. So one of the symptoms of kidney disease is bubbles in the urine or foamy urine, and I'll just share a picture real quick. We'll reference and drop this article down below, which is really good from 2019, but you can see here, this is really, really foamy urine, but just straight from a patient with nephrotic syndrome. And, they went and broke down all the different things that are in it. And we'll talk about that for just a moment in a minute. But, foamy urine or bubbles in the urine is a sign that you are spilling protein. But one of the things, the main thing is usually you're spilling some sort of protein. So I always like to say you have leaky kidneys. We talk about leaky gut. You can also get kind of leaky kidneys where the mechanism of filtration is altered because of inflammation, because of the disease process. And because of that, you have protein that should not be getting into your urine. And when you pee, that ends up creating bubbles. And, different people at different stages, this is a sign that many, many people are familiar with. Yeah.
So what is it that, is there different levels of foamy urine? Can you get, like we were saying before, is there a 5+? Is it the worse the foam or the more foamy it is, the worse your kidney disease? Does it work? Is it simple as that, or is it more complex?
Yeah, that's a good question. So actually, interestingly enough, it's a very subjective measurement. So it really is something where you can't necessarily measure it, right? You don't go into the doctor and like, oh, I had 100 foamy urine today. Like you can't measure it, right? It's just a visual, it's just a subjective, it's just an opinion. I have more bubbles, I have less bubbles. And that's really where kind of you draw the line on measuring it. Yeah. Usually if you were to confirm what's going on in a lab result, you would have a urine test, and it might say you have like 6+ protein, not 6+, 2+ protein, 3+ protein, but you'd have like a level of protein in the urine. And most people can kind of match that more or less with what they're seeing when they pee.
Okay. And, apart from protein, is there any other things that will cause bubbly urine?
So protein is most common. That would be primarily what we would be looking at with kidney disease. There's a couple other things that can drive it down too, and have cut some of my notes over here, but you may see foamy urine if you have a gut issue going on, especially if you're not metabolizing your fats very well, or you're having an excess of bile acids. If you have celiac disease, that could also create some foamy urine as well. So those could be a couple other driving factors as well. But I like to think, bacteria, if you think of, and you and I are just talking about this, but if you think about the foam that comes on beer, right, that's from fermentation, that's from that process. And the same thing is, you can have this bacterial overgrowth in your gut that could drive some of that foamy urine. I would say that would be lower on my like what's going on list, because first thing I'd be like, whoa, like what's going on with your kidneys? But if you have pretty good kidney function and you're still seeing foamy urine, and maybe your labs aren't saying like, whoa, you've got a lot of protein in your urine, you might start thinking about what might be going on in your belly.
Yeah, interesting. Yeah. Okay. And can bubbles indicate anything else? Like we said, okay, so it's not just protein that will cause it, but can the bubbles, like you said, it can mean celiac disease or a gut overgrowth. Is there anything else disease-wise that it could relate to or mean, or?
Yeah, so some of the things that you might see, is you might see it with a cadmium toxicity. You might see it with Wilson's disease, multiple myeloma, or some other areas where you might have what they'd call this amino aciduria.
Yeah.
And that could manifest with some bubbles in the urine as well.
Interesting. So the big take, what I'm hearing at the moment, is it's most likely to be a kidney issue due to protein spilling over, causing these issues. So you would go, okay, I've got some bubbles in the urine. I'm going to go see my GP, get a kidney function test. If that comes back altered, see what my levels of protein in the urine are, and then go from there. If, though, those all come back normal, I'd be thinking, okay, I need to definitely have a look at my gut function, and then look at some of these other things like and we know cadmium is the biggest heavy metal that will affect kidney function too, right? That is the worst heavy metals for kidneys. So then I'd be maybe looking at heavy metal toxicity, ruling out some of these other big diseases and those sort of things. And out of interest, can foamy urine be something like, if you have a once off, is it something to worry about, or is it, if it becomes an ongoing issue, you would look into it?
That's a good question too. For me, once off of anything doesn't usually mean anything because you just don't know, right?
Yeah, exactly.
Right? Like, who knows what happened that particular day, or maybe somebody was cleaning the toilet out and they left something in there. I don't know, right?
Yeah.
So I never really put a lot of weight on a once off. It doesn't mean you should ignore it, but it means you pay attention for the next thing that happens. So if you notice you had like really foamy or bubbly urine, and that had never happened before, the next time I go pee, I would be paying attention to that. And if next time it was like, oh, nothing happened, then I still would pay attention at least like for another 24 hours to see if it happened again. If it didn't, okay, like who knows what happened. But if it happened again, if it repeated itself, if I didn't already have a diagnosis of kidney disease, I 100% would go get things checked out and see what's going on. Because with kidney disease and any chronic disease, the earlier you tackle it, the easier it is to turn things around. If I already know I have kidney disease and I'm seeing protein levels increase, I would have questions about that, right? I would want to know what's going on and start stepping back, especially into my lifestyle, and seeing if I had changed something that was going to be making things worse.
And when you have a patient come in with foamy urine being, let's say, one of their key features, how do you tackle that as a renal dietitian? What changes and what success maybe have you seen with whatever it is that you implement for that?
Yeah, so if I see a patient that has foamy urine, I'm not so much going to like zero in on like, let's solve the foamy urine, right? That would be short-sighted. That would not be working from like a comprehensive Like, let's actually solve the real problem.
Yeah.
But I would be paying attention to it, because when we start making changes, and I'll give an example here in a minute, it's actually one of the first things that my patients will comment on, that they see changes.
Fascinating.
Because you start making dietary changes and you're not going to get labs like a week later, you're not going to get labs 2 weeks later, 4 weeks later, but you'll get but you'll see things, right? And you'll notice how your body feels. So just an example of this. So we work with a lot of patients that are later stage, right? The GFR is less than 15. They want to get to transplant. And so they're holding onto their kidney function as long as possible. So we had a young man come in, and he really wanted to get to transplant and not go on dialysis.
Mhm.
Him and his wife, I think, had just had a baby, like young couple. And he was following, kind of a low protein vegan approach, and but was still seeing this decline, a lot of foamy urine. And we said, okay, well, what you can try is doing a very low protein diet with keto analog, which is a very aggressive nutrition approach that you can use in those later stages. We use it, a good bit for our people that have very late stage kidney disease. So he started following this approach, and he wasn't doing nothing before. Like, he actually had a really, really great nutrition plan already. He'd already worked with a dietitian, came in to us to kind of hone it a little bit more. But what he noticed first off, when he brought his protein down to that really, really low amount and added in the keto analogs, you never want to drop your protein super low without having some sort of amino acid support, like a keto analog.
Yeah.
He noticed that the foam in his urine and the protein in his urine decreased significantly enough that he noticed.
Wow.
It was a really, really big change for him. And for him, this was a good approach. He was able to hold his function in that like 9-10 range for almost a year and a half, until he was able to get a transplant, and he skipped the whole dialysis experience.
Amazing. We have done another podcast on keto analogs where you go into this in detail, but they really can be quite a savior for people in later stage to really preserve kidney function. That's a really good indicator of that.
Yeah.
All right.
So like, we'd use it as a symptom to see if what we're doing is working, right? If we started an approach, especially someone maybe that has nephrotic syndrome, right? Or tactic inflammation. And that would be something I'd be really interested in. Okay, so we've put in these interventions. Have you noticed anything change? Have you not noticed anything change? But when we notice that things are changing, then we know we're on the right track, and we can keep moving in that direction. The other reason I like it is because GFR is a cruddy number, right? It's unpredictable. It's kind of all over the place, but you can't argue with symptoms, right? No. GFR, okay, plus, minus 5, 10, like, who knows? It doesn't matter except for the trend. But if people are saying, I feel better, I feel more energetic, and I have definitely noticed my urine has changed, those are some signs that are really, really positive, that you'd want to lean into as signs of success rather than hanging your hat on GFR.
I think that's such a great point. And because we understand that protein in the urine, and we know protein damages the kidneys because the size of the particle and it going through the nephrons and it blowing holes in it, for a very unscientific way of explaining how it works. If you can stop that and that's not happening, it's a great indicator that you are not causing further damage to the kidneys by the interventions that you're doing. So that totally makes sense to me. And of course, your eGFR shouldn't decline if the major driver was a protein spill. Of course, if there's other drivers, that's different. But yeah, no, that makes complete sense. So apart from therapeutic nutritional interventions like keto analogs, minimizing protein, and I know I can talk about some herbs in a minute, but is there anything else that you know that you would implement or think about when someone comes with really chronic bubbly urine that's, maybe one of the major symptoms that they have? Is there anything that you strategically think, apart from decreasing protein, any other nutrients or anything that you deploy in that scenario?
Yeah, so there's 3, right? 3 that like my brain goes to immediately, and this will segue into a little bit talking about the herbs. So when I think foamy urine, I think, where are we at with protein? Where are we at with inflammation? is the other really big one. Like immediately I'm like, what's going on with inflammation? And then I say, where are we at with like getting this filtration mechanism to be working a little bit better? That's not a very concise way to say it.
No, I think it is. It's good.
But the reason I think about those three separately, number one is like, okay, protein's a low-hanging fruit. If you're eating steak every day, like let's just talk about the dietary composition. And protein is controversial. It's controversial in the kidney disease world. I will acknowledge that. But to me, after working with hundreds of patients, we just know it is an easy opportunity to start, to just tackle getting the protein at the right level and the right type of protein. Then I know inflammation is going to make this kind of leaky kidney, especially if I'm dealing with autoimmune disease or nephrotic syndrome and kidney disease. Then I'm really thinking like, wow, what is driving this inflammatory response? And now I'm starting to put on my root cause hat. And then the next thing I'm thinking, okay, what else can we do? Okay, so we take care of inflammation, but then the next piece, this is where I want to start thinking about the herbs. I'm like, do we have any tools that we can put in place that's going to help, help us reduce that proteinuria, anything that's, beyond just like overall systemic inflammation? That's a big picture. But are there more acute inflammation measures that we can tackle with herbs, right? That we can tackle with herbs or with other nutritional supplements.
Yeah.
So that's how my brain works.
Yeah. And just for those wondering, there are 3 key herbs that have a lot of scientific research behind them. The bulk of the herbs in our Kidney Prime formula will, one of their benchmarks in the clinical trials is they decrease protein in the urine. But Shen or red sage, Salvia midorrhiza, which is our main kidney herb. It's the one that's been used the longest. What Shen does, it's antifibrotic, which I love about it. So it reverses the fibrotic processes that are going deep inside the kidneys, which is what causes your eGFR to decline, right? Because the kidneys become fibrotic, so you're not filtering properly. So we see, think of a nice flexible substance and then it becomes fibrotic and hard, and that just, you can't filter properly. So Shen reverses that process and allows more flexibility by allowing really deep microcirculation. So it improves blood flow right throughout the body, which is great if you've got things like diabetes, cardiovascular disease, because that's part of that process, right? When you've got cardiovascular disease and kidney disease, there is damage to the little capillaries that feed nutrient and oxygen into the kidneys. So Shen really supports that, and it's been shown to decrease protein in the urine, probably because it's reducing the fibrotic process, meaning that you've got nephrons and your tubules have become more flexible. So as protein comes through, it's not hitting a hard thing and breaking it apart. I'm trying to make it as simple as possible, but you've got more flexibility and they're allowing protein particles to get through without causing damage. So you're not getting a spillover.
Yeah.
Yeah. And then Astragalus, or Astragalus, as you would pronounce it in the US, we say it differently in Australia. I was like, Astragalus. People are like, we have no idea what that is. Oh, Astragalus.
No one knows how to pronounce it either way.
Right. Well, in England and Australia, it's Astragalus, but Astragalus. That does the same thing. It's because of it's because of this antifibrotic part that it has about it. So that one does the same thing. Interestingly, another herb which isn't actually very specific for the kidneys, but St. Mary's thistle or Silymarin, milk vetch is its other name. It's a very hepatoprotective herb. So it works on the liver. That has also been shown to decrease protein in the urine. And I would have to go and look into the studies about what mechanism that works behind. It might be antifibrotic as well. We know in liver disease, when we use things like Silymarin, it regenerates liver tissue. And so I'd assume it's got, if you've got liver fibrosis, it might be working that way as well. It doesn't have this deep microcirculation component to it like Shen does, but potentially it's antifibrotic. I don't actually know the mechanism behind that one, just the other two, because they're big main kidney herbs. So they're the big 3 that I would think of employing if I had someone with everything else you said. And, you know, 101, like you said, don't go to herbs. You've got to really do the dietary intervention and look at your protein intake. That's the most obvious place to start. And then you use herbs to maybe look at healing some of the tissue and maybe reversing some of that fibrosis while you're taking the driver off behind it, if that makes sense.
Yeah. Well, and I will say, Fiona, that when we have patients start some of the Kygenesis products, I have had patients after like less than a week, they'll message me and they'll be like, I've noticed my urine's not as foamy. And I'm like, great. Yay, like we're going the right direction. Yeah. And that's like, you know, like we put some dietary foundations in place. And, you know, a lot of people real skeptical about adding herbs because there's a lot of stuff out there that's kind of like and like it makes me nervous too, like your guys' product. But finally they'll be like, okay, like I'm ready to try this, and they'll put it on in a few days. They'll be like, I've noticed something's different. And I've always been interested and impressed by how quick that is, like less than a week.
Yeah, it's funny you say that. I had an email.
Yeah,
been a patient of mine I've been treating for since I started being a naturopath, so 20 years, and she just emailed me and said her dad's got foamy urine. She sent me the labs, of course. He's in stage 3 kidney disease. It's not been flagged, a typical story of kidney disease.
Yeah.
You know, he's got tea-coloured urine and blah, 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 terrible diet. And we put him on Kidney Prime, Kidney Advance. And same thing, she said within a week, his urine has gone back to a completely normal colour. So I was like, and who knows, like he started to do some dietary interventions. But even I was like, wow, week, that's, you know, and whether it's just that absolute increase in blood flow straight into the kidneys, which just turbo, you know, it's like turning on the Incredible Hulk in a sense. You get more blood flow in there. Of course, the kidney tissue will function better. I can only think that's the immediate uppick, because I think the antifibrotic process would have to take longer, but increased blood flow from those herbs can be pretty immediate. So that would be my guess of the fast turnaround mechanism in there, which is, it's great, you know, like we know our products work, we love them, but it's great getting feedback from everybody else, especially when it's so fast, because I'm like, wow, okay, that's really cool. So
yeah.
And that's our point early, you know, the body has this amazing ability to heal itself, including kidney tissue, if we just give it the right environment, the right dietary stuff, you know, all of that sort of stuff. So
Yep, I'd agree with all of that.
So anything extra you want to add about bubbles and foamy urine that we haven't covered?
I don't think so. I think as a recap, if you've noticed that and you've never had kidney workup done, or you've never paid attention to it because it's missed all the time, talk to your general practitioner, talk to your physician about that, and make sure you understand if you have kidney disease or not. So, because it's just such a common symptom.
Yeah.
If you already know you have kidney disease and you're seeing protein in your urine and you see it worsening, definitely you'd want to be digging. I mean, even if you just see it there, period, you definitely want to dig into some dietary lifestyle interventions, because that can be really, really helpful. I mean, I always think of it like a pyramid, right? Nutrition is at the base, nutrition and lifestyle is your base. Then your next level might be digging into a little bit of root cause. You might do some holistic, some functional medicine testing. Do I have nutrient deficiencies? Do I have food sensitivities? You know, do I have a gut issue? And then you want to add on some supportive supplements, the right supportive supplements. There's hundreds of supplements you can use for kidney disease. You want to get the right supportive ones. Yeah. And if you kind of follow this format, nutrition and lifestyle, make sure you're tackling like, you know, core causes, get the right supplements on board, you can get a really good plan in place that can address the kidney disease, which then what you would see as a symptom that improves would be the protein in the urine.
Yeah. Great. Well, I think that covers that topic really well. Jessianna, thank you as always for joining me. If you've listened to this and you think, wow, I really need to work with a professional like Jessianna to really get on top of things, and I recommend anyone with kidney disease to at least have 1 or 2 consults with a renal dietitian to really, even if you're following our program and it's all spelt out in there, you can get it really tailored to your individual needs. So the team at K&I is, you know, we work with them really exclusively because they get it and they get you as an individual. So I've got the link in below, but it's kidneynutritionalinstitute.org, and Jessianna's got a full team of amazing renal dietitians there. They're all hugely competent and caring individuals that can work with you. Jessianna, thank you. Make sure you hit subscribe and like the video. That means you'll get flagged anytime we put up new content. And if there's anything in particular that you want Jessianna and I to discuss, make sure you dump it in the comments below and I can flag her so she can get her research brain on and have a look. So again, thanks for being part of our community. Jessianna, thank you again for your time, knowledge and expertise. I'm always grateful for you, and we'll speak to you all later. Bye.
Okay, sounds good. Bye-bye.
Bye.